Tell us your names.
Bill DeVore.
And
Karen DeVore.
Husband and wife.
Yes.
Wonderful. And you're both doctors. What kind of a doctor are you?
I'm an anesthesiologist.
Okay, and what kind of a doctor are you?
I'm a dermatologist.
Wonderful. And so you, I presume, worked in hospital.
I did.
During COVID. And where did you work? You don't have to give the name.
I have a solo practice, so I was totally outpatient during COVID.
Okay.
And always.
Well, so interesting, because we've had two very brave nurses on today talking about this area and what went on. So I presume we'll start with you, or both of you. You can just chime in. But you must have seen quite a lot.
I did. I was on the front lines when COVID hit, and I was called emergently to do the intubations. And during that time, a great deal of fear of putting on PAPRs and the suits and seeing horrific patients come in with airways that were like we'd never seen before. Hyperemic, which means they were very reddened by the inflammation and the response that they had from the COVID, and they were needing to be intubated.
Okay, that's interesting.
We did have to do that because they were so sickly. But what we saw was the response thereafter of trying to keep people from coming into the hospital. That's where physicians at the hospital began to belittle physicians who were questioning some of the therapies that were being proposed, such as the vaccines coming or remdesivir, things of those nature. And for countries or physicians locally that were using alternative medications with success, many doctors were looking down on us for speaking, saying, hey, what about some hydroxychloroquine or other alternatives? And we were kind of looked at as maybe being idiots.
It caused a lot of divide in the medical
Yes,
professionals. And so were you pressured into getting the COVID shot?
I was pressured.
Oh, I'm sorry to hear that. And are you okay? Did you have any?
I did not take it, and
Oh,
actually left the hospital system and became an independent locums doctor, and have been able to avoid getting the vaccine through all of this.
So were you forced to leave, or did you just?
I left on my own because of the nature of the environment of the hospital with the COVID vaccine and the coercion and some of the celebratory events that were happening as people were getting the shots, and then the protocols that were being utilized. I couldn't be a part of that, and so I left the hospital system after 30 years at the same place.
That's really sad. I'm sorry that happened to you. So we're hearing from the people around the country, and we've only been, 2.5 months, maybe coming up for 3 months on the road, and they're all saying the same thing. They're all saying that they all had these little pulsy oxygen things on their fingers, and they panicked. They admit that they panicked when it got below 90 or whatever, went into hospital, ended up on remdesivir, ended up being vented, and, well, they're dead, as you can see. They're dead. Something fishy is going on. And I'm not a doctor, I'm just listening to all these stories, and we'll put them all together and try and figure it out. What do you... it doesn't seem to make any sense, but we've had people coming on telling us that there's a lot of money to be made, which sounds awful, but the hospitals, it has a lot of money to be made from the remdesivir, the ultimate COVID death.
I mean, that is true. You could even get your funeral paid for if you had COVID on your death certificate.
Really?
Yes. So, there was financial incentive to diagnose COVID any way you could, even if you came in with a car accident or a gunshot wound. There was a lot of incentive to use certain drugs and certain treatments. There was a price on a patient's head, really. And, as an outpatient physician, I've been treating patients with hydroxychloroquine and ivermectin for years. They are the safest drugs just about that you can find. And when COVID first came out and I realized these drugs had been used for SARS-CoV-1 with some success, and everywhere I turned, people across the country and across the world were reporting success, and I knew they were safe, and I was familiar with them. I knew how to dose them. I knew how to use them, and I thought, what do you got to lose? If you've got nothing else to offer people except for turn blue and go in the hospital and get ventilated and get remdesivir, why would you not try these things? And, you know, to my knowledge, not a single patient that I treated early on in the course of COVID as an outpatient with hydroxychloroquine or ivermectin ended up hospitalized, ventilated, or dead.
Whereas versus the hospital and these reports, where
Correct.
where here
These
the
were
opposite.
not the patients I saw.
No.
Heard about them, but not the ones I saw.
Did either of you get COVID?
No.
No.
Did you have the shot?
No.
So both of you stood firm and said no. And you had to leave your job. What happened to you? Anything or nothing?
I'm a solo practitioner, so since I'm kind of my own boss, I didn't.
It's the way to be.
Exactly. I didn't force myself, nor any of my employees. And I think I only have one employee who took the vaccine, and she was older and took it to travel and whatever. And after she got sick on the second one, she said, I'll never take another one. So she's not had any boosters, and she's done fine, thankfully.
Now, as a dermatologist, have you seen anything like this turbo cancer?
Oh gosh, yes. I mean, I have seen the most rapidly growing large basal cells, and they're supposed to be a slow growing kind of cancer. I have seen squamous cells rapidly growing, metastasizing, spreading so much faster than I've ever seen in 30 plus years of practice. I have seen more melanomas, more aggressive melanomas, and they don't present like normal. If there is a normal, they don't present typically. So you have to really have a high index of suspicion. They are more amelanotic, which means they don't have color. And we're not catching them, or at least I'm not as early. By the time they're coming to me and I'm biopsying, they're stage 4. And then the patients that come to me, that I've been taking care of some of these patients for over 30 years. And if you come every 6 months or once a year and you update your doctor and you update your forms, the number of patients that have come in that have out of nowhere been diagnosed with stage 4 lung cancer, colon cancer, prostate cancer. There's even a 58-year-old gentleman who's 60 now, but after the COVID vaccines and 1 booster, he goes from healthy, on no meds, fully employed, to being diagnosed with not 1, not 2, but 3 kinds of cancer in the last year and a half. And it was urinary cancer, prostate cancer, and now out of nowhere stage 4 lung cancer.
It's out of control.
It's totally out of control. The number of young people that have stage 4 breast cancer, ovarian cancer. I mean, this is hearsay if you want, because I'm seeing their family members. These aren't people I'm taking care of, but this is what I'm hearing, and I never used to hear stuff like this.
But are you seeing a rise in skin cancer or whatever you call it?
There's always a lot of skin cancer, but I'm seeing more aggressive skin cancer, more rapidly growing skin cancer, more metastasizing skin cancers. And I've seen lupus and psoriasis and eczema and every autoimmune disease out of control. And I've seen itching, burning, stinging, skin described from on the inside out. I mean, descriptions
Moderna.
I've never heard before. And I've been taking care of itchy people for 30 years.
The Moderna side effects are horrific. They talk of burning inside their skin, itching out of control, scratching their skin off.
It's just something I've never heard. I've never heard descriptions like I have since that COVID vaccine came out.
I had an interesting patient, a teenager, who came to get a EGD to look in her esophagus and her throat because she was having strange sensations in her neck, the tingling and some discomfort. And so she had gone to the ED because some of it was in her chest, the discomfort, and so they did a little cardiac workup because of that. When it turned out she had elevated troponin, unusual in a 16-year-old female, totally healthy, bright, thin girl. Well, she went back for follow-up. They drew her troponin again. It remains elevated. Chronic elevated troponin may be a signal for myocarditis. And so she's having all these skin manifestations, swallowing, funny feeling with swallowing, with this elevated troponin. And I asked her, had she had the vaccine? Just to put it out there as a drug reaction sort of manifestation, and she had. And I asked her, did the cardiologist or any of these other physicians who have been taking care of you to get you to this point, have they mentioned that it could be from that as a possibility? The answer was no. Not a one.
The number of newly diagnosed atrial fib, pacemakers, blood thinners is unreal, and blood clots and DVDs and pulmonary emboli. And again, this is intake forms. What's changed in your health since you were here? What new medicines are you on? The number of neurologic things, the number of people with tremors, balance problem, Parkinsonism, nerve palsies, ALS. Something's out of the ordinary from the previous 30 years I've practiced.
So what are we going to do about it? How are we going to save the future, if you like? Sounds dramatic, but I mean,
Stop
this
the
is
vaccine.
just...
Yeah, the first thing is stop the vaccine immediately. I mean, there's even been evidence proposed or presented that this vaccine has DNA contamination, and that this may be part of the turbo cancer. And the fact that our own state leadership heard testimony for 6 or 7 hours to that effect, and our South Carolina DHEC went out after that, 6 or 7 hours of testimony. Even if they didn't believe it, they could have said, we need to halt it and we need to confirm it and we need to find out if it's true or not. But no, they were out in 2 days promoting this vaccine after they had just heard all of this information.
Promoted it was safe.
Yeah.
And they had heard
And it
hours
was
of
tested on
testimony.
8 to 10 mice. It wasn't even tested on humans.
That's right.
Yeah.
I think one of the most concerning things that no one is talking about really, or few are, but not enough, is our military, who were mandated the shot or they were fired. And that's our defence.
Yeah.
Yeah, it's
They're in a bad
horrific.
way.
That's
Horrific.
terrible.
Healthy.
You know, young, healthy people
young-
who get lots of exams too. So when you see that, I think that was one of our first signals too, was all the problems that the military was recording, that something was amiss.
The risk was not worth losing your personal rights. The risk wasn't there for them. They didn't have a risk of dying, even if it was something that was of concern. And maybe, let's say, all of this was real. The vaccines worked, or this was a COVID, it was a virus, and potentially not some other entity as a bioweapon or things. But let's just say all that was true, but the risk of dying or having a significant infection from this was so low. Why run the risk of getting a shot put in your arm like that? Were they just
That was experimental.
propping up the pharmaceutical companies because of the amount of cost it was, the money they got for giving vaccines to all the military? Was it a payback for someone? I don't know.
And it should have been a big warning signal to people that nurses, doctors, EMS, ER personnel, they worked a whole year of COVID without a vaccine, and they were the unsung heroes. And then this vaccine comes along, and they are forced to take it. They have seen COVID. They've lived with COVID. They've probably had COVID. They probably have natural immunity, and they're beginning to see things they haven't seen and very unusual, and they decide they don't want to take this vaccine, and they're told that by, I think it was September of, what year would that have been, 21, that they were going to lose their job if they didn't take it. I think the fact that the number of hospital and healthcare workers who refused to take that vaccine and lost their job over it should have told anybody that there's a problem. These people aren't losing their job over nothing.
And people like you, who've worked in a hospital for your job for so long, and you're done. You just have to move on. My biggest concern also outside of the military is the sort of college-age students, who we sent some reporters out to interview them, and we were shocked by their, first of all, ridiculous amount of masks. I mean, like 4 or 5 masks. And then they watch, they take all their news from CNN or whatever, I don't know what they were saying, and they believe in the CDC. They don't think, they're so brainwashed, and they're the ones that are still taking the boosters. No matter what, we had someone else come on this bus earlier today saying that even though some of these kids are sick, they still don't think it's a shot, and they're paralysed or whatever. They've just taken their next Pfizer or their booster, and they're still going to go back for another one because at least they're not dead. That age group is the most concerning. What do we do about it?
First, we need to get back into our education system to evaluate truth. They have replaced truth. Yes, they've replaced truth with all sorts of fantasies, so that they don't know how to do a true analysis of a situation. They just go with what's being told, and they love passion. So they've got them in this passionate state, believing whatever fantasies, subjective fantasies in their head, and they go at it full steam without thinking of what's really true behind it. Wait a minute, am I really at risk? Maybe no.
You might think all of a sudden deaths in athletes and young people. You might think infertility. You might think new diagnosis of chronic disease. You might think somebody would put it together even in a young population. It seems obvious.
It's extraordinary.
Where did we go from? We used to have 25 athletes in perfect health a year worldwide die suddenly, and now it's over 25 a month. Something's not right there.
The propaganda machine
They just squelched it.
incredibly formulated and acted upon, and it did go after our youth.
And I do think there were doctors and nurses and just insurance and coroners and pathologists and morticians who were trying to tell the truth, and they were silenced.
Right.
So it's
Punished.
and punished and threatened and lost their licenses. And so it wasn't like the people weren't trying to get this out. It's not like, maybe not enough, but it's also that not only were there very few brave enough to try to do it, but they also were punished, penalized.
So how come you both have figured it out and a lot of your colleagues haven't?
I think my whole life I've treated my health as an important part of every day, and so I didn't need a vaccine to maintain my health. I felt as if I was good enough. No guarantees. I could have gotten the virus. I could have died. I could have anything. But I knew one thing, that I've done a long lifetime of trying to maintain healthy habits. So people who want to reach for a quick shot to counter a whole lifetime of poor behavior, they were scared to death. And the things the medical community missed at that point was, hey, use that fear to get yourself back, get your diabetes under control, let's get your weight down, let's do the things that were killing people when they got COVID, that is the morbid obesity, the diabetes, the hypertension that wasn't good. Let's see so that if something does come around, such as a normal, maybe let's just use flu as a normal, okay? Then you'll do all right. They were scared to death. They were scared to death.
And I think for me, I have never in 30 years of practicing medicine received information on how to code for deaths as a dermatologist. I've never received information. As a medical student, it was pretty obvious. I don't think anybody even trained me as a medical student. You name, place, date, time. What do you think they died of? Well, let's see, they're on the heart ward and they had a heart attack. They're in the cancer ward. They just came in with a car accident. It really wasn't rocket science to fill out a death certificate. And so I thought, this is weird. Why am I getting it? And at first I deleted the email, and it just stuck to the back of my mind. And I went back a few days later and pulled up and read it and thought, oh my gosh, something is not right. And then I started getting information, and I don't know why I would come across my email or my news feed, and I would look it up and I would read it, and I'd go back to show it to Bill or pass it to a friend or a family member, and it'd be gone, and I couldn't find it again. And I'll never forget, I don't know his name, there was an anesthesiologist in New York City, and of course New York was hit hard or hit early. And he was saying, I've never seen airways like this. This is really, really unusual. And he was talking about intubating the airways. I couldn't wait to show it to my husband, who was intubating him, and saying, is this right? Do you agree? This guy is saying, he wasn't even sure it was infectious, but he was just saying, this is not your normal airways. And, I never could find that guy. I don't know what his name is. I never could find his little YouTube or his whatever again to show my husband. Judy Malkovich, I'd find her stuff and it would disappear. And I thought, what is going on? This is really strange that I can't find things I want to go back to or reference or share or fact check myself. It would just disappear. And I've never, and so I don't know, my antenna that something was up was heightened during all that.
My antenna was up also because I used biblical knowledge and biblical truth, and things stick out when it's not true. It just, you have that sense, a spiritual sense that something's
discernment.
Something just, yes. And so it was immediate that I had that. And I will agree with what Karen says. The airways I saw acutely. I've intubated patients with bacterial pneumonias. I've intubated patients with viral pneumonias. I've intubated people with congestive heart failure and fluid overloads. This reaction was totally different looking physically when I would look in there than anything I'd ever seen. And that's why I said this isn't a virus. And that's when I said this is a governmental, this is something that has been developed by something. This is not a natural response. And the inflammation was just horrific. I've never seen inflammation like that in people's airway so immediately. So
what do you think it was? It is.
It would all be subjective.
Of course.
It's not natural. I can
Spike
say
protein.
That. I can tell you what it's not. It's not natural. Because I've seen natural for 30-some plus years. I've looked at airways every day of my life. Tens of 20s of airways every day that I go to work. I've never seen airways look like that. And so I can say what it's not. It wasn't natural.
So if it wasn't natural, describe what you were looking at.
I'm looking at the back of the throat, down into your main stem trachea, down into the lungs as I put it into your tracheal tube in. These airways were on fire. It looked like they'd had gas poured down them.
And could that be because before they get to you, they're on all those cocktails of remdesivir and all that? Could that have been part of it, or no?
No, these are people that were before this. These were
Okay.
the people that I was praying that my wife or others would be able to keep out of the hospital before they got to this stage, and they weren't getting any help. It came in when they were needing to be intubated.
Were they vaccinated with the COVID shot or
This
unvaccinated?
was before the vaccine.
This was before.
So we're
This was
seeing this
early,
is the
early,
virus,
early.
is what you're saying.
This is that first stage
The
of the
virus.
virus.
Interesting.
Right. Yes.
This is before the vaccine.
Right. This is a different stage. We've got different COVIDs. We've got the acute COVID that started. Now we've got the COVID post-vaccination COVID results. And now you've got some other variant and things. So it is a little bit of a historical view that I'm giving. We don't see this now as a different kind of picture. The more the injuries we're seeing now the multiple cancers I see patients coming in for now, and the degree that cancers that had been in submission for years and decades and now have come back are patients that come in that have 2 or 3 ovarian cancer or lung cancer, liver cancer. I didn't see
didn't
this.
you have an ovarian cancer in like a 20-something-year-old or early 30?
No,
Really
it's
young.
Again, are these
Yes.
vaccinated with the COVID shots?
Yes.
So the turbo cancers we are
Yeah.
thinking is that's from, because we're seeing it in the people who've taken the COVID shot. This, what you're seeing, I find that fascinating.
That was the original
The
COVID.
original, so forget the shots. This is people who just got the virus,
Yes.
and you're seeing something like biological weapon, which lots of people are talking about type activity going on in there.
Yes.
Something different, whatever.
So
it was.
why some people, not others?
I don't know, and I will say this. My initial thought, and I told Karen, I said, I wondered at that time, was the process of all the decades of vaccinating, making our bodies into an immunological, you've just thrown a match on gas. All the vaccinations and all the manipulation of our immune responses. Why did some people's immune response react this way to that virus and others just got a little sniffle? This is a design. Something was designed to do this, and it was just too much of an extreme.
Some kind of gain of function went on there.
Do you both have children and grandchildren?
4 children and 2 grandchildren.
Do you worry about the future right now?
I don't really worry about the future. I kind of worry about the day and things, and try to make good decisions as a day and our children have.
They've made good decisions. That's great.
Yes.
Congratulations.
Yes.
Mostly good decisions.
No, but I think we know what we're talking about. They're all going to be okay.
Stay in the moment, because it's moving too fast.
That's right. Is there anything else you both want to say? Thank you for this fascinating conversation. I think many doctors would agree with you on your thoughts and definitely on what you're talking about with the turbo cancers and everything.
Just thank you for what y'all are doing. The Children's Health Defense. I mean, the publicity and really sticking through years when it was even harder to do this than it is now. I think we're having a little bit of an awakening about vaccines in general, about all the vaccines, and I think COVID has really brought it to the forefront.
I can be honest with you. I would say my take-home message would be for any parent who is considering vaccinations that are being recommended either through the CDC or through the physician as well. I didn't have one lecture in medical school ever on vaccines, not one, and neither in residency or post-grad education. So I would say for parents to get knowledge so that they can truthfully make a decision. Is this necessary? Is this shot necessary? I believe they will find that it is not, and that we are just propping up an industry that is causing harm and making a lot of money doing it.
And to continue to say they're safe and effective, I think everyone has to say that's not effective. People have had multiple shots. I think I've got patients who've had 9 shots now, and they've had COVID 3 or 4 times. So it's not effective. It's not working. And is it safe? I think there's a whole lot of evidence
Not where we're standing. It's not.
Mounting to say it's not safe either. So if it's not safe nor effective, why are we continuing to do it?
Well, you are both everything we love in doctors and how doctors should be. Can we get back to that?
I would love that.
Yes, we are trying to get truth back into the exam room and not feeling like our hands are tied for speaking freely with patients, whether you're owned by a corporation and you're working as an employed physician. We need to get back to informed consent, true informed consent, and that would be our first
And
step.
back to privacy and individual health care, not one size fits all for everybody.
And good food. Food in
nutrition.
the stores is disgusting now.
Yes.
Okay. Well, thank you both so
You're welcome.
much for your bravery and your
Thank you for having
wonderfulness.
us.
Yes,
It's been a pleasure to talk to you. I've really enjoyed it.